Receiving a diagnosis of macular degeneration can feel overwhelming. Many people leave their eye appointment wondering, what should I do next? In this lesson, we'll walk through the most important first steps people can take after a macular degeneration diagnosis. Welcome to Macular School. I'm Corey, a certified low vision therapist, or CLVT. In this series, we explain macular degeneration and share practical strategies that help people stay independent as vision changes. Today, we're looking at the first steps people can take after being diagnosed with macular degeneration. Many people leave their eye appointment with many questions. There may be unfamiliar medical terms, new information, and uncertainty about what will happen next. Some people are told to return for follow-up visits. Others may be referred to another doctor or specialist. And many people leave the appointment wondering, where do I even start? This feeling of information overload is very common after a new diagnosis. Many people begin searching online and quickly encounter a large amount of information. Some of that information is helpful. Some of it is confusing, and some of it can even be misleading. That is exactly why Macular School exists. The goal here is to break this information down step by step so people can better understand the condition and learn practical ways to adapt. So in this lesson, we will discuss several of the most important first steps people can take after a macular degeneration diagnosis. One of the most important first steps after diagnosis is making sure you are receiving the right medical care. Macular degeneration is usually diagnosed by an eye doctor. In many cases, patients are referred to a retina specialist. A retina specialist is an ophthalmologist who focuses specifically on diseases that affect the retina and the macula. These doctors have advanced training in diagnosing and managing conditions such as macular degeneration. Regular eye examinations are extremely important for people with AMD. During these visits, doctors often take detailed scans or photographs of the retina. These images allow the doctor to monitor changes in the macula over time. Tracking these changes helps guide treatment decisions and determine when additional care may be needed. It is also important to ask questions during your appointments. Understanding your diagnosis and your care plan can help you feel more confident about managing your eye health. Another important step after diagnosis is learning how to monitor your own vision between appointments. Many doctors recommend using something called an Amsler grid. An Amsler grid is a simple square grid made up of straight horizontal and vertical lines with a small dot in the center. To use it, a person usually holds the grid at reading distance and focuses on the center dot. Each eye is checked separately. If the lines appear straight and evenly spaced, that is generally reassuring. However, if the lines appear wavy, distorted, bent, or missing, that could indicate a change in the macula. This type of simple self-check does not replace regular eye exams, but it can help people notice changes in their vision between medical visits. If someone suddenly notices new distortion, blur, or a dark area in the center of vision, it is important to contact their eye care provider. Early detection of certain changes can make a significant difference in managing the condition. Another important step after diagnosis is protecting overall eye health. Certain lifestyle factors are known to influence the risk of progression in macular degeneration. For example, smoking is strongly associated with increased risk of AMD progression. Avoiding smoking is one of the most important steps people can take to support eye health. Nutrition may also play a role in the retina health. Some individuals may be advised to take supplements based on the AREDS research studies. These studies examined certain combinations of vitamins and minerals that may help reduce the risk of progression in some individuals with macular degeneration. Your eye doctor can help determine whether the AREDS supplements are appropriate for you. A healthy diet that includes leafy green vegetables, colorful fruits, and fish may also support overall eye health. Maintaining healthy blood pressure and cardiovascular health can also support circulation to the retina. Another extremely important step after diagnosis is learning new vision strategies. Many people are not aware that there is a field called low vision rehabilitation. Low vision rehabilitation focuses on helping people use their remaining vision as effectively as possible. Specialists in this field teach practical techniques that help people adapt to vision changes. For example, individuals may learn techniques such as eccentric viewing. This strategy helps people use areas of the retina outside the damaged macula to see detail more clearly. Low vision specialists may also teach ways to improve lighting in the home environment. Adding a bright, focused light, like a task lamp, over a reading area can often make printed material easier to see. Increasing contrast between objects can also make everyday tasks easier. Magnification tools can enlarge text, labels, and small objects. These strategies make activities such as reading, writing, cooking, and organizing medications much easier. Technology can also be extremely helpful for people living with macular degeneration. Smartphones, tablets, and computers often include powerful accessibility features. These tools can enlarge text, increase contrast, and even read the text out loud. Voice assistants can help people interact with technology without relying entirely on visual detail. Electronic magnifiers and digital reading devices can also help with printed material. Many people are surprised to discover how many tools and resources exist to support independence. Learning about these tools step by step can make a significant difference in daily life. Many people with macular degeneration continue to live active and independent lives. They continue reading, cooking, traveling, and participating in meaningful activities. They simply learn new strategies that help them use their vision more effectively. Understanding the condition is the first step. Learning strategies and tools is the next step. And with the right information and support, many people successfully adapt to these changes. The key message to remember is this: there are many resources, tools, and strategies that can help people adapt to macular degeneration. With the right information and support, many individuals continue living active and independent lives. In the next lesson, we'll explore another common challenge people notice after diagnosis: why reading becomes more difficult with macular degeneration. Thank you for viewing. See you in the next one.